nonchalant attitude and non-respect of preventive measures by Douala denizens is worrying to the Public Health Minister, Manahoda Malashi, who fears the economic capital could be the hardest hit region by the deadly coronavirus. Barely 3 months after the death of Adamudam Joya, the CDU party has fallen into turmoil as far as leadership of that party is concerned, with most contesting the legitimacy of Tomino's election as national president of the party ahead of Siri Sam Barka. Details of this and many more will be yours in a bit. Good evening, ladies and gentlemen. Thanks for joining us on the 6 p.m. newscast on Spectrum Television. I am Catherine KONE. We'll begin the news in politics. The designation of Patricia Damjoya as the acting president of the Cameroon Democratic Union at the expense of Siri Baga is causing cracks within the party. The mayor of Fumban has lashed out at criticism over her election, arguing that her election was legally based. Details with Peter Susi.
Patricia Tomainon Damjoya says she is shocked at criticisms within the Cameroon Democratic Union Party over her election to lead the movement following the death of Dr. Adamun Damjoya. The widow of the deceased argues that though the first vice president, Cyril Sambaka, is contesting her legitimacy, she was duly elected by the political bureau of the party at a meeting in Fumban on April 24, 2020. She will lead the party till the next convention. The former member of parliament wonders whether the party was supposed to wait for Cyril Sambaka sick during the time of the meeting to recover before moving ahead after the sad demise of the party's leader. She also questioned whether the first vice president was in good shape to attend the meeting. Mrs. Damjoya reveals that it was impossible to hold an extraordinary convention due to the current COVID-19 health crisis, and the next hypothesis was to hand over the presidency to the first vice president on interim basis, and this is where things played out. Owing to the fact that no statutory mechanism prescribes that the first vice president automatically succeeds the president, she explains that Cyril Sambaka and herself were put on the same scale, and it was on this basis that the Politburo designated her to lead the Cameroon Democratic Union.
And staying in politics, the women win of the ruling CPDM party for the and educated on how to combat the spread of coronavirus. The 3-day event is organized by Senator Marie Amand Dimbel. Details with Ajara Ali.
Washing of hands using hand sanitizers and respecting preventive measures against the spread of COVID-19 pandemic was the brain behind this 3-day seminar organized by the CPDM Wuri Senator Madame Dinbel Marie Aman. When someone dies, we shouldn't touch the corpse. As the expert says, COVID-19 is contagious. Respecting social distancing, these women of the ruling CPDM party did not only benefit from the sensitization campaign, but equally receive goods of basic necessities that will accompany them during these difficult periods of confinement.
And the littoral region is said to suffer more stigma and shame in the COVID-19 cases in Cameroon, thus a risk zone, as Public Health Minister Manahoda Malashi explained on CRTV yesterday on Seine de Presse. He called on denizens in the littoral region to rush to specified health center for immediate medical attention. Details of this with Josephine Binzi.
Cameroon has had now records over 1,400 recovered cases, over 100 deaths, and about 1,000 active cases. The central region is gaining adaptability as compared to the littoral region, as Public Health Minister Manahoda Malashi explained on CRTV Seine de Presse yesterday. the economic giant of Cameroon, Douala, is a call for concern with regards to infected cases, as many more persons suffer stigmatization which aggravates the health conditions of most patients.
Les grandes frayeurs que nous avons aujourd'hui, c'est au niveau de la région du littoral.
The greatest fear we have is in the littoral region. There are reasons why we are scared for this region. There is a stigmatization of COVID-19 cases. We have to try as much as we can to stop stigmatizing COVID-19 patients. I want to say this in strong terms to all Cameroonians, that the COVID-19 disease is not a disease of shame. So if you have symptoms or something that resembles the virus, go to a nearby health unit in your region to get tested.
The rise in the number of deaths in the littoral region, he says, is by reason of shame and disgrace, contrary to the political capital that welcomed the very first cases, but is responding positively in battling against the pandemic.
It's discovered you are positive, you will be treated. The central region is doing better. The disease began in the central region, and in the beginning we tried several strategies. But I can tell you that people are very much informed about the disease. In the central region we have a very impressive protocol we are following and very good medical personnel.
Personnel de santé qui s'occupe au quotidien.
Stigma, he rules out, is one of the causes of the rise of the COVID-19 infections in Cameroon's economic portal. Reduced checkups and hospital visits increases more community infections. Thus, he urges Douala city dwellers to embrace the odds that accompany the disease to get treated in due season.
Health workers and inhabitants in the Momo division have benefited from COVID-19 benevolent action by Emilia Ngenze. The consignment consists of hand sanitizer, face masks, and equally buckets. The gift is coming at a time where the Northwest region registered more than 8 cases with 1 death. Details with Josephine Binzi.
The health rally against the COVID-19 pandemic heightens in the Northwest region, where Senator Emilia Ngenze donates some hygiene and sanitation materials to kick out the pandemic in the Momo division.
Yes, it definitely does. Even if we had 0 cases in Northwest region, it is still a call for alarm because it is in other regions. And we know with the means of transmission of this virus, once one person is affected, there is a very high chance that he or she must have transmitted it to another person even before being diagnosed. So there is actually a cause for alarm.
This move has been fueled by a giving number of challenges.
It's very challenging. I think the first challenge is that from the patient themselves. To counsel the patient, inform the patient of their results, counsel them, and for them to accept these results, that this is their condition, for them to accept that they will need to separate themselves from their loved ones to be treated is also a challenge. But I'm happy so far that all of our patients have been very cooperative, part of health workers. It is challenging for us because sometimes you begin to think that should I even risk myself, should I abandon the job? But this working in the health field is a calling. You cannot abandon sick people no matter the sickness that they have. You just need to find a way to take care of them.
In the presence of authorities and health workers, the motivation continues as she boosts the local population to remain on an alert as the virus may come knocking like a thief in the night.
We now take you to Edea in the Senegal Maritime Division of the Littoral region that has recorded 1 COVID-19 death with 6 suspected cases since the outbreak of the pandemic in the country. Due to the increasing number of coronavirus, parliamentarians from the division offered COVID-19 kits to the population to enable them prevent the disease from spreading. The items comprised of buckets, hand sanitizers, face masks, and equally food items items. The gifts were handed over to Taxi Drivers Union, the prison, Muslim and Religious Communities Women Association Network, amongst others. And now, coronavirus-related risks are not covered by insurance companies in Cameroon. Experts say it is due to the pandemic. The pandemic is as a result. Peter Soso spoke to an expert and our report.
Insurance companies in Cameroon will not cover risk related to the coronavirus. According to experts, this is because of the global situation of the health threat. There is a transfer of risk from the insurer to the state. This is why the Minister of Public Health has always said that COVID-19 treatment is free. So the insurer does not take the risk of COVID-19 because it is incurred by the state, as it has been declared a pandemic by the World Health Organization. The exclusion of pandemics from covered risk is also improved by a halt in medical evacuations, which constitutes a large chunk of insurance expenditure. Several stages are involved. The client is the first stage. The insurer also has a cover from his reinsurer, who has made it clear that there is respect of regulations, since there is a transfer of competencies to the state. The coronavirus will not adversely impact the insurance sector in Cameroon, as stated by Proter Ayagma, an insurance expert. Transport, travel and car insurances could be impacted more or less significantly.
And as of now, Cameroon has 2,579 confirmed cases of coronavirus, including 1,465 cured and 114 deaths. These figures or statistics were published by the Minister of Public Health on his Twitter account. How does a Cameroon waste management company handle waste disposals from hospitals and ordinary waste disposals unit during this time of coronavirus? Ajara Ali answers the question.
The coronavirus pandemic has put the resilience of our society to test, as we tend to focus more on the fight against the spread of the pandemic, with the Cameroon Waste Management Company explaining their role since the outbreak of the disease to the community.
Contagion, nous avons mis en place au sein d'ISACAM plusieurs séries de mesures pour contribuer à cet objectif, parmi lesquelles le
renforcement. To cut off this chain of contamination, we have set in measures to protect our workers. The workers have received face masks, as we know they will be deployed to work in the hospitals. We have to protect them in the process of collecting waste.
De distribuer principalement ces masques-là à son personnel, parce que ISACAM est conscient de ce que dans la manipulation des déchets, il peut avoir un danger.
To the Regional Director General of the Waste Management Company, it is time to work toward protecting those who work at the waste disposal unit or where COVID-19 patients are being confined.
Les déployer dans toutes les formations hospitalières qui peuvent accueillir des malades Covid, de sorte que dans une formation hospitalière,
we have fabricated a model of trash cans that will be installed in our health units and the different centers that will handle COVID-19 patients. These trash cans will be transported carefully so that no one manipulates the waste and avoids contamination.
Il faut qu'elle soit dans un bac spécialisé complètement fermé. Nous viendrons la récupérer ce bac-là autant pour moi, et nous allons le traiter de façon à...
To crown it all, he called for an urgent need for a smooth movement of waste collection and recycling without increasing contamination rate.
And following last May 30th lifted barrier measures by the Prime Minister and Head of Government Joseph Diongute, where he laid emphasis to the public, lifting these barrier measures and activities regained doesn't mean the public should relent effort in maintaining personal preventive measures. Details with Violet Sekum.
It's over a week since the barrier measures to the COVID-19 has been lifted This has relaxed the efforts of some people found in public places around Yaoundé without face masks who use the heat as coverage. There's this burning heat I get when having my face mask on, especially out here, so I prefer to take it off. Meanwhile, some are so alert about the existence of the virus. I don't like going to bars now because of the virus. I prefer buying my drink and taking it home to drink. More to that, I don't want strangers in my house till the end of this crisis. I use hand sanitizers and face masks to curb the virus, especially when leaving my home, and also tell my children to do the same. Well, after my training at the hospital, I know the risk I'm exposed to if I don't follow these preventive measures of washing hands and putting on face masks. I don't receive strangers in my house anymore. I confine myself, except there's an emergency which has brought me out today, but if no, I'm always home. The fight to quit the dreaded COVID-19 propagation is still on the line, as sensitization from government and some NGOs are strongly gaining grounds.
We now talk about religion. Muslim culture of togetherness and gathering is threatened as the coronavirus ravages throughout the world. Muslim leaders have called on their faithfuls to be able to align themselves with the new measures put in place by the government as they carry on with their Ramadan fasting. Violet Sekum once more report.
As Ramadan wraps up with COVID-19, which is still a cause for concern and has crept into almost every region of Cameroon, the government is still at the front line imposing measures which will help to stop the propagation of this virus, though some Muslims during this period still find it difficult to respect social distancing amongst them, as coming together is part of their culture. General Coordinator of Imams, Dr. Musa Umaru, confirms. It is difficult to explain how Muslims are responding to these changes, and even Cameroonians at large, because in every society there are so many mosques, of which there must be those who resist to these measures.
Naturellement, il y a des postes de résistance.
He further pleads for more sensitization in Muslim milieux, so they'll be aware of the dangers of coming together. Sensitization amongst these Muslims are still highly needed. Repetition is the mother of education. We have to keep sensitizing, because to change human mentality is not an easy thing. And if we don't insist, it's difficult to attain our objective.
C'est difficile d'atteindre l'objectif.
As days go by, the government is doing everything on its part to sensitize the public, more on hand washing, wearing of face masks, and social distancing of 1 meter, which will go a long way to bar the dreaded corona pandemic in the society.
The staff and unionist or trade unionist of the Cameroon Drug Control and Valuation Laboratory, LANACOM, who have been claiming 4 months arrears for the past 2 weeks, have today suspended their strike action. The grievances were temporarily resolved in a meeting last Friday that had in attendance their board chair, who also doubles as the Minister of Public Health. Details with Emmanuel Kenjisi.
For the past 2 weeks, these workers of Cameroon's National Drug Control and Valuation Laboratory, LANACOM, have been staging a peaceful protest over their 4 months arrears. They have been mounting pressure on their board chair, who doubles as Cameroon's Minister of Public Health. Nonetheless, he attended to them last Friday, the 8th of May. Also, he made available 1 month's salary to them.
Vendredi le 8, nous avions
On the 8th of May, our board chair, who equally doubles as the Minister of Public Health, met with us here where we were striking. After the meeting, he assured us that our grievances are being sorted out, as the head of state has ordered that the sum of 300 million CFA francs be set aside to solve our problem. So he asked us to resume work while the money is being processed.
En attendant que cet argent-là soit débloqué.
That notwithstanding, the workers will not hesitate to resume strike if the rest salaries are not paid by month end.
If salary are not paid, the strike will continue, but if the salary is paid, the work will continue as we resume it today.
They blame administrative delays in disbursing finances as the sole reason behind their strike and pray it does not happen again.
I think the problem was a misfunction or dysfunction of some administration actions. So the coordination was not full, and now every counterpart sit down and to look up solution that this kind of strike to not be here again.
LANACOM is a public administrative institution placed under the technical supervision of Cameroon's Ministry of Public Health. Among its duties, the establishment is actively in charge of controlling the quality of chloroquine, a medicine prescribed to relieve COVID-19 patients in Cameroon. With many fake tablets already in circulation, interrupting work at LANACOM over strikes could give room for more counterfeit drugs.
The Southwest Governor Okalai Bilai, Benato Kala Bilai, has strongly condemned the brutal killing of the mayor of Mamfe, Priestley Ojong, by a group of suspected armed men in an ambush on his way to his native Eshobi, that is in a Manyo Division, Southwest region of the country. It is found in a communique signed by the Southwest Governor Benato Okalai Bilai. And news out of the country as the U.S. and other countries slowly lifts up restriction put in place to contain the coronavirus pandemic. Corporate America is looking on how to return to normal, but officials say it will likely be a new normal, one different than during pre-COVID times. Details with VOA News.
What many hope are just temporary changes might have a longer-lasting effect on both the economy and the daily life. 2 months of teleworking has shown that at least some employees can successfully and efficiently work from home, which can mean a reduction in demand for office space.
Working in New York City, which is very expensive, as are many of the major financial centers around the world. These are very, very expensive cities to operate in. We have a very high fixed cost base. Number one is typically your lease, is your office expense. If you can cut that by 20, 30, 40%, the space that you need, that's an enormous cost savings.
If the demand for office space goes down, this will force the lease prices to go down as well, experts say. Today, the average office lease price in New York City is $750 per square meter a year. Coronavirus lockdowns have also shown that many employees can successfully do their jobs from home. And that means employers may now find it possible and efficient to hire employees regardless of where they are based.
Having employees work remotely saves a lot of money. So companies not only realize that they can save money on office rent, they could even start hiring people who don't live in New York, people from other areas and states where average salaries are lower. That will also allow them to save money.
The pandemic, experts say, may do more than just change the way whole business spheres operate. It can also alter business etiquette and routine. The number of conferences and business trips will go down significantly, especially when physical presence is not crucial.
I'm having meetings, virtual meetings with 6 people, 8 people, 10 people, and we're learning how to do this more efficiently with clients or vendors around the world or around the country. I don't need to get on a plane. Every time that I travel or one of my employees travel, yes, they're traveling for that meeting, but they're also missing potential work that they could be doing otherwise.
Smaller number of business trips will directly affect hotels that rely on business clientele. Work with business partners may be structured differently, skipping face-to-face meetings when possible.
Certain situations that I think is still going to be very, very important. But in other situations, it's less important, and especially, I think, demographically, just the younger generation, I don't think they need that as much. they're used to a more virtual world versus some of my older clients and customers. They're not as used to that virtual world. They do want to sit down. It is important for me to make the effort to go and see them.
Experts say changing work habits, lower demand for hotel rooms, office space, and public transportation are just some of the changes that likely await corporations and businesses in a post-COVID world. For Evgeny Maslov in New York, Anna Rice, VOA News.
This advert from Prudential Beneficial Insurance.
As the world goes through one of its toughest moments yet, insurance companies have been facing a backlash for unpaid indemnities in relation to the coronavirus. But Prudential Beneficial Insurance have their clients covered.
Claim during this period of pandemic, but in addition to that, we decided to add another cover which is free of charge to all our clients. So meaning our clients, in case of a claim that is linked to the pandemic, they get their benefits on their contracts, but they have a supplementary contract which we have added, which is free of charge, and this covers death as well as hospitalization. For the death part, we pay $1 million in addition to your normal benefit, which is a pro-B COVID product. And also, if you are diagnosed with COVID and you are hospitalized, we also provide you some daily cash payments to enable you go through the difficult period. So it's a decision that was taken at the group level across the world. So in all the other subsidiaries of Prudential, we're doing that as well. There's actually a fund that was set aside by Prudential Worldwide, which is about 480 billion francs CFA, which is going to cover such situations.
Prudential Beneficial Insurance, which has been around for over a century, has handled global crises like the coronavirus and is now making life easier for their clients by paying claims much earlier.
We have put in place, normally the regulator says when all documents are available, you have 30 days. In Beneficial, our policy is 2 weeks. I mean, that's in general. But as far as COVID is concerned, we've said that, and we put in place, since we know the emergency that goes around it, so we put in place procedures which will enable us pay within 48 hours. So once a claim is declared, we make sure that we get it paid within 48 hours. For now, we've had 4 claims. We had 4 claims which have all been paid, all hospitalization claims. So we had our clients who tested positive and they were hospitalized. So we pay them the daily claim, the daily amount for the benefits. There are 4 of them so far. We haven't had registered in that claim for now. Well, not saying that it doesn't exist, but it may be not yet declared to us. But in the event where we have it, we're going to take care of that, just as we're doing for the hospitalization claims.
In order to respect the basic preventive rules, getting insured during this period has been made simple. We've put in place an online subscription system where you can actually subscribe, since we know movements are now being restricted. Maybe our agents can come to you, so you have the possibility of actually going online on our website and you buy a policy which automatically makes you part of the Pro-B COVID cover. So any policy you buy from us, automatically you also have the cover for the COVID. Free of charge. It's important to mention that it's an additional cover that you don't pay for. Prudential Beneficial Insurance is also making sure that they sensitize the population to respect the basic hygienic rules in place to save lives.
That brings us to the end of the 6 p.m. newscast on Spectrum Television. Thanks for watching and have a beautiful evening.